Dr. Glonti and work for the Belgian Royal Military Academy at the Queen Astrid Military Hospital, Laboratory for Molecular and Cellular Technology in Brussels. The title of our work is Design of Phage Cocktails as a harness against antimicrobial resistance in Pseudomonas aeruginosa and Klebsiella pneumoniae. Carbapenem-resistant Klebsiella pneumoniae and Pseudomonas aeruginosa are an emerging cause of healthcare-associated infections that pose a significant threat to public health. Recent advances in phage therapy supports its potential use as a complementary or alternative tool to combat antimicrobial resistance and difficult to treat infections. In this study, we designed 14 different cocktails from 18 different genera of phages for both species, Pseudomonas aeruginosa and Klebsiella pneumoniae. We have used a very large and diverse bacterial panel to test phage cocktails, including 3 main resistor types of Pseudomonas aeruginosa, PA01, PA7, P14, and Klebsiella pneumoniae phage strains producing carbapenemase KP3 and strains of 5 different capsular serotypes. The phage lytic activity was studied in parallel for each individual phages on planktonic bacterial cells in OmniLog system that generates high throughput kinetic readouts based on respiration of bacterial cells. Here we developed an interpretation model to evaluate phage and planktonic bacteria co-proliferation, growth of phage-resistant mutants, and inhibition of bacterial population by phage. That the relative respiration unit in the range of 0 to 60 were considered as an indication for phage clearance effect. The phage bacteria co-proliferation curve that didn't have the same shape as the control bacterial curve, and it resulted in high RRU, was considered as the growth of phage-resistant mutants, and the phage bacteria growth curve with a shorter exponential phase and reduced and constant RRU compared to the control bacterial curve was considered as an indication of bacterial inhibition by phage. Using this interpretation model, it was found out that phage B and T cocktails, for the most part, performed well, inhibiting phage-resistant mutants and resulting in either a synergy when phage combinations give higher potent effect than in a single mode, or in a protocol operation when the combination of phages give the same effect and they don't need each other to interact to give better clearance. The phage virulence, the development of phage-resistant mutants, and their correlation with bacterial virulence and antimicrobial resistance are of great importance to therapeutic use of phages. And the interpretation model we developed here could easily be used to monitor the development of antibiotic resistance and evaluate the mode of its dynamics. Developing of new rapid screening methods for antibiotics, phages, or other antimicrobial susceptibility testing is crucial to minimize the antimicrobial resistance. Thank you for your attention. For questions, you can always reach me on LinkedIn, on X, or just email.